How you doing?
I gave you a new background today.
Yeah, that's a nice. Is that the living room?
No, it's my family room.
Oh, your family room. Okay, cool. Nice T-shirt.
See, it's my family
Yeah,
room.
that's that'd be
I,
nice.
aw, thank you. I can do that because my roommate's not sitting at her desk trying to
Okay.
work today.
Tell me about your shirt.
We got one shot. This is our shot.
Okay.
This is
What
our
is it?
shot.
What is it representing?
Get your vaccine.
Okay, nice.
This is your
Cool.
shot. You got to get your shot. I'm here today to talk about getting your shot. We need to encourage people. We are at 60% of 18 plus, and we want to get to 75% of 18 plus by the end of May. That's the goal. And I want to ask everyone who is watching today, all 120, I can see the number, to
Yeah.
please, if you haven't been vaccinated, make your appointment. There are appointments available, and we have lots of choice now. There are lots and lots of choices, and soon there are going to be 2 more pop-ups. Bruce Power is going to be sponsoring one at CAA Center in Brampton, and there's another employer-driven one for the construction industry
Right.
that's coming online. Well, it's online now, I think, as well. There are
Does anybody get a T-shirt that says "This is your shot" if they get a vaccine?
well, I'll tell you what, I went to dose this after dark on the weekend, and yeah, I already had my dose, but as I was walking through, they gave me a T-shirt.
Oh,
Mhm.
they didn't push that out. You know how powerful T-shirts are
I
for
know,
instance.
right? Isn't it a great shirt?
The great shirt. I'd rock that.
I'm not even going to
I'm
run
trying to
in this
sound
one. I'm going to keep this one for, media.
So let's get going here. So May 2-4, I feel like this weekend, okay, is the weekend that is going to determine whether or not we get out of lockdown June 2nd, or we stay in lockdown until July 1st because of the behavior. So
I like your attitude. I really, really like your attitude. That is so true. And if
it
people
is.
start gathering in big groups, guess what? In 2 weeks, mid-June, our numbers are going to skyrocket. Because I
Yeah.
was going to give you the numbers, and we were both going to celebrate and say, yay, because things are really coming down, like by about 70%. Like
So
huge numbers down. And
I
and
think
but if people gather this weekend and start partying to celebrate the 2-4 weekend or whatever it's called, the long weekend, we won't get out of lockdown. So
so. Let me ask you
this is
this.
your shot to get out of lockdown.
That's a multi-purpose T-shirt.
Multi-purpose.
So I got to ask then, is there going to be more enforcement this weekend on May 2-4 weekend?
So yeah, I mean, obviously, because we know that that's going to happen, and there is a new protocol coming out tomorrow from Peel Regional Police as well on large gatherings. And
Okay.
the one that's been kind of slipping through the guidelines is protests and rallies. And why is that allowed when you can't go visit your mother? So the police are going to come out with new guidelines and procedures and protocols tomorrow on large gatherings, and they're going to crack down on those a little bit as well. But of course, because that's, we have a park ambassador program out, we've got bylaw enforcement out, we've got Peel Regional Police out, and they're going to be looking for people who are gathering that aren't supposed to, or
Yeah.
not practicing safe, physical distancing, we're not wearing their masks. I think I got a mask that matches almost. My red one.
Okay.
They're
Everybody,
everywhere, right?
trust me, everybody knows how to wear a mask now. So,
That's right, right? And it's almost part of our culture now, right?
yeah,
It's almost
yeah.
part of our culture. I feel like I'm always going to have one in my purse, and if I go anywhere where there's a large crowd and I'm feeling a little claustrophobic, I'm going to put my mask on. But
So,
the thing about the mask is it's to protect you from me,
yeah.
right? Right? It keeps your germs here, so it protects other people from you. So everybody has to wear them.
Mayor Crombie, you mentioned about new protocols by the
Peel Regional Police.
Peel Regional Police. You're saying that there's new protocols coming for protests?
They're calling it large gatherings, but I'm sure it
Okay.
will capture rallies of that variety, yes.
Okay. All right. I hear that the province might be getting rid of the color-coded system.
See, you got the inside scoop before me. Really, where are we going to move to?
Well, that's the thing. So let me ask this: June 2nd, what's gonna happen? Like, are we gonna open? Are we gonna
Do you
close?
remember my do you remember my press conference last week? What was the key message? Clarity.
Yeah, yeah.
We need clarity. We need to understand what are the metrics, what are the indices that will allow us to progress through the color-coded framework. Or if there's no color-coded framework, what happens? Tell
Yeah.
us on June 2nd, are we staying in lockdown if we're going out? How are we going out? What will be open? What will be closed? How will we decide? Who will be open? Who will be allowed to reopen? So that's what I asked for last week. I probably try to hit that message again tomorrow in my press conference. Better clarity on what the rules are and the expectations are, because people want to plan. Businesses want to know, should they recall staff? Should they should they start reordering products? Right? That was the biggest thing in that brief little reopening we had, was retail got all staffed up again, only to have to go into lockdown again. And, we had outdoor patios for a brief period as well. They ordered in food. We need to plan. So we need to know, what are the rules? Is it a color-coded framework? And if it is, we all know red is 40, right? But what's gray? What's gray?
100.
Somebody said 80, but see, that wasn't really clear either. So how do we go in and out? And who decides, and when do we decide? And what if Mississauga is doing really well?
So how about this? Okay, so June 2nd, I'm just going to add another layer to that question. June 2nd comes about, and it sounds like the province also is not going to open up region per region. It's going to open up like all of Ontario. If they do open up all of Ontario on June 2nd, will Peel Public Health kind of say, hey, hold on, we're not ready yet. We're going to add another 2 to 4 weeks. Like, is that something that will happen or can happen?
I don't know how far Dr. Lowe's Section 22 authority goes, but certainly in sectors it could, right? Yeah. He did close schools. He can close businesses. Can he close an entire sector? I'm not sure.
Okay.
He did schools because that's public sector, right? So he can. But can he say sofa manufacturers?
Yeah. Okay.
I don't know that he can, right? But tell me when you want to talk about the numbers, because I have.
We can talk. Okay, yeah, we can talk. So these are all the numbers of COVID in Mississauga.
The cases, right?
The cases.
As of 1 hour.
Is somebody coming in? Is somebody coming in?
Yeah. Well, I heard something at the door, but no, probably an Amazon drop off.
Yeah.
Okay, sorry, I don't mean to be so cheerful, but I was happy. I was quite elated when I saw these numbers, because I still remember we were 60 cases per 100,000. What was that, 10 weeks ago?
Yeah, a month and a half ago, I think. Yeah.
Well, maybe a little longer, maybe 2 months. It's all blur. It's a big blur now, isn't it?
Yeah.
I should keep track of the weeks better. Okay, so hot off the press, as of today, the epidemiology report is out, and Mississauga is at 170 cases per 100,000.
Okay, awesome. And
last week, it was 240. The week before that, 280. So we went 280 to 240, and now it's a pretty significant drop, right? 70 cases per 100,000. That's pretty significant. But the good news, it gets better. The R factor. The R factor is 0.7.
0.7, okay. And last week was 0.8, from what I remember.
0.9 for us. The week before that, 0.97, so almost 1.
Okay.
But Peel Regions was 0.8. Peel Regions it's really good. Why don't I go through it? So the cases per 100,000 in Peel are 232, which is basically where we were last week. So this is the average of Peel, weighted average, of course. Mississauga's 170. Khaled's the same, 171. So Khaled, Mississauga on par. Brampton's really come down. Okay, we've got to give them credit. They're down 50 cases per 100, almost 60 cases per 100,000. 327 versus 387 last week. Right? So they've come a long way. They're coming down fast too. And the week before that, they were at 455. So things are really improving.
Good.
Okay. Now just look at the R factor. So we're 0.76. Khaled is doing really well, 0.66. And Brampton's pretty good, 0.87. Everybody's under 1, significantly under 1. That is so important. You want, right? Because that means when it's 1, you are definitely communicating it to one other person, right? All right. And then positivity rates. The positivity rates are really coming down. We're at 10%, Khaled 9, and Brampton 14.5. And let's look at Brampton's numbers, because they're making pretty dramatic changes, pretty dramatic drops. So 2 weeks ago, they were 19% positivity. Last week, 16% positivity. And this week, 14.5%. So like really, really coming down. I'm so pleased. And we're cheering for Brampton because it affects us, right? We can't reopen until they reopen by the rules. So we want Brampton to improve. We got to ensure that they improve. We're going to send everybody to get vaccinated. So that's the EPI report. Very, very pleased when that came out. Things are going very well. Now, come this weekend, everybody has big barbecue parties, invites all the neighbors, and guess what happens June 15th? Dr. Lowe says, oh my gosh, look at the numbers again. Look at the hospital, look what's happening in the hospitals. Our hospitals, case numbers are all under 100. We used to have 25 to 30 people, new cases coming into the hospital every day. We're under 20 now. We're averaging about 15 new cases every day in the hospitals. Even the ICUs have capacity.
True.
So my question yesterday on the public health call, so when can we talk about elective surgeries resuming? And so apparently there is a table discussing that strategy on how everyone will reopen elective surgeries at once, because otherwise if it's one hospital, one-offs, then that hospital will be inundated, right? So they're discussing the strategy for bringing back elective surgeries to all the hospitals in Ontario. That is such great news that we're at that point where we are discussing the strategy to reopen elective surgeries. I would say mid-June, early July, if things continue, we'll be back to having elective surgeries.
Good. So now with all these numbers, do you think in 2.5 weeks then everything's good to go June 2nd? Because it's all positive, you know.
So let's say we're on a trajectory to continue to decline at the rate we've been declining. So in 2 weeks, let's say, so we're 170 cases, we'd be at 100 cases per 100,000. Maybe if we were really good in 3 weeks, 80. Will Dr. Lowe allow us to open? Maybe not yet. Maybe he would go back to capacity limits in retail, capacity limits in, maybe he would allow some outdoor dining. We've got to, right? We've got to. Everyone's got to get their patios up and going. The weather's warming up. But, you know, it'll be a hard, it will take a little more time, I should say, for indoor dining, for sure.
Yeah,
for sure.
Okay, let's talk about vaccines. Okay, so I guess it's this week that the province has stopped allocating 50% of all vaccines to the hotspots, which is Toronto and Peel. Are you worried about this move, and do we have
I am, and tomorrow, in fact, you know, I've had some of the kind of I call them celebrity doctors, you know, high profile doctors.
Doctors now.
I've had high profile doctors at my press conferences the past couple of weeks. As you recall, I had Dr. Abu Sharkawi 1 week, right? I had Dr. Isaac Bogosh last week. And then tomorrow I'm having Dr. Andrew Bazari. And he's going to be talking about the need to continue at 50% for hotspot zones, but also giving us flexibility. Like, you know, there are some weeks when, you know, last week when we have received so much vaccine, we almost didn't have the capacity to get it all into the arms, right? We worked really hard and we did. But, you know, you got to stage that out a little bit too, because now we have a lot of capacity. So now we can handle a lot more vaccine. And now we need people to register. So appointments are available. Please, you know what to do, right? peelregion.ca/COVID-19 vaccine. As easy as that.
Yeah, true. It's been sheer confusion in regards to the vaccine rollout, though, just because this morning, you know, I hear somebody saying, could 16 plus get vaccinated? And we're the media, right? So I'm like, I call up, you know, Peel Public Health, and I'm like, hey, is it 16 plus now?
When you and I are confused, there's a problem with the communications plan, right? Because we're on the inside and we should know these things. And there were a couple of weeks where I'm like, what was that again? 18 plus, is that hot zones? Is that everywhere? Like, people are asking me, and I don't even remember. So there are going to be, and I don't know if I'm allowed to tell you, it's embargoed, but Thursday there's going to be a big announcement.
Oh, okay. About what? I guess it'd be 12 then, right? Okay. So I'm not going to say anything. So, well, my next question.
Don't say anything. Don't say anything. We can't announce it. But that's the rumor. That's the rumor.
Well, you just told me on live Instagram live. So anyways, so
Do you
my
know how
next
much trouble I get into after these little, and then I'm like, you shouldn't be doing those every week.
your, your popularity is at an
I get
all-time
into so much trouble because of you. But a big announcement, we don't know, maybe it'll be 16 plus, who knows? But a big announcement on Thursday
high. Okay.
about
So,
opening up categories. Well, so we've been at 18 plus now for 2 weeks, and other regions have just moved to 18 plus, right? York region,
yeah.
they're just moved to 18 plus. So it'd be a big stretch to open it up further. But wait till Thursday, there might be another announcement.
Okay, so the next question I had was 12 to 15. I shouldn't ask that
You know, there might be clarity later in the week.
then. Okay, all right. So here's one really left field, very niche question here. It was just announced that the federal government is investing close to $200 million in resilient
Yes,
biotech
yes,
in
that's
Mississauga.
what I've been saying. I've been saying the two things that are needed are supply and allocation. Allocation to hotspot zones
Yeah,
and supply. And we needed domestic production. That's how
yeah.
you increase supply.
You
And
get
by
it from Mississauga.
next year, I put forward two names of plants that I knew had the ability to turn over, to turn over their current production capacity to accommodate vaccine production. And they were one of them. So this is resilience. And that
Yeah.
is such exciting news. And if you've been in Mississauga for a little while, they've rebranded. They used to be called Therapure. So they're up in Meadowvale area, north of the 401. And so I am over the moon happy about this announcement because it does mean we will have domestic production and we're going to be doing it right here in Mississauga. So I'm
Sure.
so ecstatic about it. And you know that we are the second largest life sciences sector in Canada. So of course they should look here to us for the production of vaccines. So I am beyond happy. I'm over the moon that this is going to happen here. So hopefully I'll go over there and cut a ribbon. We'll be allowed to do so. So yeah,
Yeah.
I knew the announcement was coming. I just didn't know when it was going to, the federal government, they have to get all the pieces in
Yeah.
place before they make the announcement. But I'm just so happy. I'm so thrilled. I'm so thrilled for resilience that they were selected and that it's going to happen here in Mississauga. And that's been a problem, right? No domestic production. So next year, by the time we all need our boosters, because we will, we'll get it domestically.
So you think that
Vaccine.
so there's a chance that resilience might actually be the first domestic
Could be.
vaccine.
I think there was a plant or a site in Quebec chosen as well, but I
Yeah.
don't know. I don't know how far along they are and if they've started to retool or started production, if they have the licensing agreement in place yet. I don't know any of that. But maybe we could be first out of the gate. I don't know. Therapure has the ability. They have the capacity. They have the talent. They have the skills. They have the people, and with a bit of incentive from the federal government, then we're going to make it happen. I am so thrilled.
And Trudeau believes in it. So
I believe in it too.
yeah, true. Okay, I gotta ask this too. Gyms, okay? I see a lot of gyms on my stories and they're open.
Well, they're not
Is this
supposed to be.
I know they're not supposed to be, but
Right.
do you think this is a byproduct of not closing the initial gym that got open?
So there is a flaw in the legislation that doesn't allow us to go there and padlock the door. Okay. There is a flaw, and we've raised it a couple of times. And because gyms do have the right to open in certain circumstances, like for disabled people who need to go and do therapy or physical therapy, right? Or they're training, whatever. And of course, Olympic athletes can train, right? There are certain categories that can go into gyms, right? And so it's hard. So they're operating in a loophole that says, well, we can open for certain classes, certain categories, but they're, of course, allowing everyone to enter without checking credentials and, they're bending the rules, and we all know that. And so we've tried to shut them down, but.
Cool. Well, hopefully everything opens up soon.
Well, I'm very hopeful. Well, fingers crossed, June 2nd, we can at least have outdoor rec, because I can't tell you the number of calls I get because, do the workout classes outside over at F45 here in Port Credit with Drew and Lish and the gang. And, you know, we're happy to do it in the parking lot. So that's workouts and outdoor recreation as well. Everyone wants soccer and basketball and baseball and tennis. And of course, there's golf, right? We've heard a lot about golf, and we've heard a lot about marinas opening too, because marinas aren't open either.
Yeah. Oh, yeah, I guess. How are you going to get your boat out?
How are you going to get your boat? Now the weather's becoming very nice.
True. You're still doing your workouts in the backyard?
More so in the basement. That just happened to be a really nice Saturday morning, and I might do it again. Maybe tomorrow morning I can do it outside. It'll be nice, but mostly in the basement. There's a setup. There's a setup there, but I'm doing them.
Good for you. Awesome. Tickets this week. Any doozies? Any good ones? Any big ones?
Now that I know what you like to talk about, I'm ready. Yes, in fact, unfortunately, there are a lot of private residence gatherings. And so, folks, we are ticketing you. And it could be a very, very large ticket if you're hosting a house party, let's be honest. And the courts will decide. And, you know, I've heard of instances where there have been $100,000 fine for the host. So be very careful. So on Wednesday, there was a private residence party, also a ticket for a gathering in a park. Friday, there was a non-essential business open. Unfortunately, it was a nail salon. So all those personal care providers, that one breaks my heart because a lot of those are run by women who are supporting children and families.
Yeah.
So that was, they got ticketed at a non-essential business. And then private parties, private residences, there were some big ones. I have 4 on Friday. One of them had 3 tickets and 1 part 3. So that's a big one. That means it must have been a huge one. Another one had 6 tickets. Saturday, again, there was one of those car meetups.
Okay.
We have those at those big box outlets. And then another private residence party. So folks, they're ticketing you if you have a party. All right, even a backyard party, if you know you're not supposed to mix households and you're not supposed to have more than 5 people. So if you're having a backyard barbecue and your neighbors are upset because your music's too loud, you could get into a lot of trouble. And then a gathering on Celebration Square, there was some tickets there as well. And then, you know, in the parks, the security highlights were just telling people to disband. It was playing basketball, skateboarding, groups having a barbecue, basketball, soccer, basketball, volleyball, soccer.
Oh my goodness.
Groups playing chess, groups playing cricket, groups playing volleyball, groups not social distancing, basketball, large gathering, Celebration Square, ticket noted above.
Did you say chess?
Chess.
Like they got ticketed or educated?
They got educated.
Oh, okay.
Educated. Okay. All the security highlights are just educated.
Okay.
And then they disband. But the big ones were the private residence gatherings that I described to you. Okay. And the car meetups. Yeah, and the one non-essential business. Those were the, you know, that's for a city our size, that's very high compliance. That's over 99.99%, right? Couple of breaches.
Most 99.9 are good. So the city banned the use of sales of fireworks last year. Are you gonna, for May 2 for gatherings, will they ban it this year?
That's right. And then we reinstated it. And I'm trying to remember where we're at with that because that's next weekend. So we have council tomorrow. Okay. We'll probably raise it. The problem with the fireworks, it's fine if it's your family in the backyard and you have burning down the house or whatever they're called, or firecrackers or sparklers. But the larger ones tend to draw a crowd as well, right? So if you go out to the park to light off your family fireworks and all the neighbors come out, now you have a gathering.
True. Okay. So I'll get Ashley to ask that tomorrow at your presser.
Okay.
That's not tomorrow. Is that tomorrow? The presser?
Tomorrow. It is tomorrow. There is some discussion about moving them to Thursday mornings, but right now they're still Wednesday afternoon. But Wednesday afternoon, 4 o'clock is kind of late in the day, so I prefer to have them a bit earlier.
Okay. Trade times.
Yeah. Well, he does his right before council, and I don't like to do that because right before council, I'm still prepping for council, and I've got people calling me, reminding me they've got a motion, and people reminding me that there's an in-camera item, and you know, I've got things happening, not just when it's press conference time, you're pretty singularly focused on delivering the message you want to deliver, which is normally get vaccinated, get the shot. Right? I want to be singularly focused, not like planning ahead of council meeting, and then I don't want to be late for council if I'm chairing, right?
True. So Toronto's canceled everything this summer. Is Mississauga going to do the same?
Well, we'll see first come September. We haven't had the discussion for September forward yet.
A couple of viewer questions here that I got. I guess the question that you've been on TV for, will recreation open before June 2nd?
I doubt it.
Yeah, okay.
They haven't opened it yet, so I'm going to assume they'll open it. That will be the first thing to reopen, I would imagine, outdoor rec. And then so what's the inside scoop you got that they're not going to go back to the color-coded framework? What are they going to do?
I don't know. One of my journalists called me and just let me know that they might not be going back to color-coded. I'm like, that's how
So what's going to replace it?
I don't know. They just...
Again, clarity.
Yeah.
Communications, folks. Let's communicate. What's the plan going to be? This is in a week and a half, 2 weeks. What's the plan?
You're right. Even if they do it on June 2nd, it's the communication part of it that might take a month to communicate. So anyways, another question we have, second dose changes. Will they be shortened with supply?
That's a very good question. And I shouldn't speculate. My staff get really nervous when I start speculating. However, we've got a lot of capacity in the system. We've already opened it up to frontline healthcare workers. So we've got to get them through first for second doses. And then we'll go through the age cohorts, because of course the most vulnerable, the 80 plus, then the 70, 60, etc. And then the essential workers. But certainly if there's capacity and there's vaccine, I don't know why we wouldn't expedite that, right? As long as all the conditions are in place, that capacity exists, vaccine exists. I don't want any appointment to be wasted. I don't want vaccine to be wasted. I want everybody to get their shot, get their first dose. And then if we're at 75% plus, which I'm very hopeful we will be by June 1, then let's start rolling out the second doses. I know the Prime Minister said first dose in the summer, second dose by fall, but at 75%. Now, herd immunity isn't till we have 75% second dose, not first dose, second dose, right? So that doesn't come till the fall. But if we've got 75% first dose, there is built-in hesitancy as well. I hope it's less than 25%, but it could be 25%. So I'd be advocating, let's just keep it going. Let's get people in there. As long as they've waited whatever necessary minimum period of time that there is, because you want the first dose to do its work before you get the second dose.
True. 2 minutes left, 1 minute left now. Last thing, once this is all over, first vacation you're going to take?
Oh, yeah. I dream about that every day, don't you? I dream about it every day, but it changes because it depends on the season. If it's cold, I want to go somewhere warm. If it's warm, I want to go, exploring or do something experiential. I love experience. Pardon me? I can't book. Yeah, I can't book. I don't know when we're going to be. We're still talking about closing airports and shutting down non-essential travel. No. I'll book. When they lift the restrictions and we're all have 2 doses and it's safe, then I'll book. Then I'll decide what the options are. It sounds like it might be closer to fall or winter, so maybe I'll want a warm vacation by then. I don't know. It'll depend on the season, but I dream about traveling again.
Nice.
I dream about seeing my friends. Tokyo, the Olympics. Is that going to go forward? Khaled.
It's going to happen. So anyways, probably in November I'm going to go, but it all depends on what happens in the Olympics because it's still going on. So.
Oh, good. All right. Yeah. I dream about that every day. I love to travel. So when it's safe, we will travel again.
All right. Awesome. Mayor Crombie, thank you so much. I'll catch you next week.
Thank you.